Good evening, everyone. This is Alamjeet Flora from Pothos Events. Pothos Events brings you the show from Sweden, Stockholm, live on Facebook. This is a 30-minute show. We have a lot of guests who have been, who've honored us by coming on the show. We've shared so much information, met so many personalities, and we are honored that they've always encouraged us to do more. And thank you, visitors, for viewers, for all our, all the love that you have given. It encourages us to keep coming with more and more. Do also write to us if you are interested in coming on the show, or you also want to, come for us to come up with some other topics. Today's topic is very close to, I should say, men and women, especially women, but also men, because they need to know what a lady really goes through in her life. Ladies and women are always, we have lived up, we've always lived in our life talking about from puberty till, our menopause or even later. People are always talking about our mood swings, about how we are, she may be having one of those days. But they don't know what we actually go through. So today is the day where we're going to discuss this very openly. And so the men also, before they speak and open their mouth about anything that a woman is, going through, she better know what really it is and what it means to say those words to us. So today I'm very proud that we have all the way from Germany joining us, Dr.Katrin Koch, who's here with us. She's a gynecologist, a naturopath, and a hormonal specialist. She has her own clinic there, and also she has her treatment methods are from natural medicine and acupuncture. She is going to tell us much more about what she does. Let's welcome her on the Wednesday Talk Show.
Thank you so much, Alam. Hi.
Hi,
Yeah. Thank you so much, Alam, for the invitation. It's a fantastic show. I've been watching your show for so long, and I especially love the last topic, the breast cancer topic. That was very interesting and so important for us. So first, sorry for my English, as it's not my first language. Sometimes I will stumble, which is not due to the knowledge problem, but to a language barrier, maybe. I'm an OB-GYN, a naturopath with praxis with 3 other doctors in Herzo, Germany. It's a little town close to Nuremberg, Munich. We specialize in the field of women's health and hormones for more than 15 years. Women nowadays are so busy with their daily life, taking care of the family, jobs, partner. So we are really all-rounders. But 70% of the people and women really ignore their own health. And that's exactly why we're here. We want to talk about our health. So, Alan, to make this topic more relatable, I put it into slides. So could you please show the viewers our first slide?
Thank you, Katrin. Yeah, I'm showing it right now.
So that's a little bit confusing, maybe boring subject, but we have to introduce this before we start. It's hormones in you. To stay healthy, you have to balance your hormones. So let's give you a quick tour through the body. Hormones are little messengers which run through our body and give information from one organ to the other. So we have the main 4 organs which we need, which communicate. It's first the brain. The brain produces serotonin, which many people know. When you have a depression, you have no serotonin, and anxiety, you have a lot of serotonin, or melatonin. You can't sleep, so maybe your melatonin is really too low. But our important hormones today is the FSH and the LH, which we call the follicle stimulating hormones, which actually stimulate the ovary to produce the egg and get into the normal cycle. The next thing is here, it's our thyroid. Many people have thyroid problems like Hashimoto's, autoimmune disease, or other hypothyroidism, where you have a hair loss, where you feel very tired and anything like that. And the brain communicates with the thyroid. That is very important. Like the thyroid is something like a motor. And then we go down to the ovaries. The ovaries produce mainly 3 hormones, which is the progesterone, which makes us nice and happy, which makes us relax, we sleep well. Then we have the estrogens, which makes everything grow. We have huge amounts of estrogen in pregnancy, for example. And then we have the testosterone, Yes, ladies, we always have we also have testosterone. We need that for our muscle tonus. It's everything for the muscle and also for the energy a lot. And then we have the adrenal glands, which are close to the kidneys, which produce cortisol and DHA. Cortisol is very close, as you can as you see with the words, to cortisone. So, for example, if eczema, you build very often you don't build enough cortisone. But also remember, many people, many women, we are 40, we're so tired. That is because our cortisol goes down. So that is also very important. Of course, we have other hormones as well, but I think that are the main hormones and they interact. So if one organ is going down with one of the hormones, the other try to balance it. So balance is really, really the root to well-being. But if it's not balanced, if you're stressed, anything like you have Hashimoto, you are disbalanced. That's what we have then symptoms, what we call a disease. So all the hormones are connected like a mobile and they have to be kept in place. So when we talk about us, we talk today about our hormones and how to get them naturally balanced or imbalanced. And a natural imbalance is actually the aging process. So that's what we experience in our life. It's from puberty to old age. In puberty, when you're newborn, you're born with about 600,000 eggs. And when you use them up, you go into menopause. You have no bleeding anymore. Of course, you have no bleeding once you're in puberty. That means the brain needs to develop, to activate. It has to send out these little messengers hormones, FSH and LH, to the ovary to wake up. So the eggs become activated. First, in puberty, the first hormone which is really activated is the testosterone. If you remember, you get the dimples everywhere, mood swings, acne. You might have a teenager daughter, and then you really know what I'm talking about. I know what I'm talking about. And then after puberty, you have all the three hormones. You have testosterone, estrogen, progesterone completely balanced. That we call the reproductive phase. That's our best phase. We are balanced, we are funny, we are full of energy. And for example, at that time, imbalance is like a postpartum depression. You remember I said you have very, very high hormones in pregnancy, then you go down. That causes a lot of imbalance and that can make a lot of mood swings. That is an example for that. After that, we go into perimenopause. That's the first stage where we have the decline. The eggs get a little bit less, so it's not enough producing of the normal hormones. We get irregular bleedings, mood swings again, and so on. And then once we are around 55, 60, we go, once menopause is much more balanced, we don't have in the egg any hormones anymore. So it's about 55 to 60, but we will live another 40 to 50 years nowadays. And so ladies, going into menopause is just half time. So when we want to get old, when we want to stay healthy, we have to work for it. We have to balance that.
So Katrin, when do these young girls expect their menstruation, their first periods, and do they come?
Yeah, that's a very, very good question, because girls nowadays, the puberty hits us a little bit earlier as we are well fed and anything. So it's about with 9 to 15 years. So if your daughter would hit puberty, you will notice, of course, it's not the little bit of swelling of the breast, but if she would really get in her menstrual cycle with 9, please go and see your doctor. And also, if she doesn't have her bleeding by the age of 15, please go and see your doctor. But if your girl has in puberty, if she has a lot of irregular bleedings or a lot of mood swings, which is very difficult for her to handle, or a lot of acne, which can leave scars in the skin, so please go and see your doctor, because it's a hormonal problem and it's a natural thing, but we could help you through these difficult phases.
Okay. And I also would like to know is what's the right age to get pregnant? What's the right pregnancy age?
Yeah. The right pregnancy age is mainly as a natural thing in at the best reproductive phase. It's in between the age of 20 to 30. Of course, you can get pregnant earlier, can get pregnant later, but that would be the best phase. If nowadays, because of the jobs and long studying and anything, so people tend to get pregnant much later. So there we really recommend that they also, if they plan it for much later, that they go to see the doctor to measure. It's a hormonal, it's called anti-Müller hormone. It's done by blood work, just to see whether the eggs are really fit enough to get pregnant if you wait for too long. because
Yeah.
after the age of 40, it's very difficult to get pregnant.
Yeah, but you see a lot of after 35 first child also nowadays. Yeah.
Yeah, yes, now it's getting later and later. But for
Yeah.
some people, really, it is too late. So it's always because now, of course, we go into prevention. So once you go to the doctor after 30, they will talk to you about when do you plan it or don't you plan it. And if you really want to take your time, then please let's test it so that you know that you can still get pregnant on a later phase.
Yeah, very good recommendation. Thank you, Katrin. Yeah,
So, girls and ladies, let's do a quick quiz. Ask yourself which phase you're in. Are you balanced or are you imbalanced? You may suffer from no of these symptoms, or you suffer from one or a lot of these symptoms. That varies up to your genetic code and your lifestyle. If you're perimenopause, you mainly have the PMS, the premenstrual symptoms. You're usually over 30 or 35, you have a loss of libido, you have breast tenderness, weight gain, you might have bloating, headaches, heavy periods, acne. So if you have these symptoms, you might be very, very likely to be perimenopause. Or you're over 45, have no bleeding for 12 months, very, very low sex drive, you're anxious, also weight gain. Hot flashes, very, very typical in the night sweats. You have memory problems, you don't sleep very well, or you're postmenopause, you're about 55, you notice that you get a lot of wrinkles, you might have a little bit leaking of urine, and your muscles get flabby and also have a lot of memory problems. That might be the postmenopause. And so you see, that is a completely normal thing, but it is not nice. It doesn't sound like a lot of fun, but you go through. And I think we are here and you're here, and you have to take care of yourself to go through these phases to see it's a natural thing. It's not a disease. It's just a symptom of aging. So let's talk about the first stage of the decline. Sounds also not nice, but it is a decline. It's actually the decline of the hormone as your eggs become older and therefore less. Remember, I said when you have no eggs anymore, that's what we then call menopause. The first thing which goes down, I told you in the ovary we produce three hormones: progesterone, estrogen, and testosterone. Now the progesterone goes down. So that happens about 10 to 15 years before menopause, and basically from age 35 or something like that, but very often also a small declines already after the delivery of the second child. So you might already experience the things which we have here: acne, mood swings, weight gain, as was in the quiz before. So what can you do if you have these things? The first thing is very natural. You have to do, if you have weight gain, you do the aerobic exercise. Exercise 3 times a week for about 30 minutes. And to be an aerobic exercise, it's very interesting. You have to have your pulse monitored. So it's actually the number 220 minus your age multiplied by 0.7, and then you're in the aerobic phase, especially when you really want to do some training. You should eat healthy. What is healthy food? I think it's a lot of books about that, fibers, not so much meat and anything like that. But also, as we're in perimenopause, just to balance the hormones, it would be good to eat with a low glycemic index. So what we nowadays call low carb diet. If you experience then from other symptoms, which are a little bit more like the mood swings, anything, we could also go in herbal medication like evening primrose, agnus castus, or yams, which actually try to balance these symptoms a little bit more. We can also do acupuncture and homeopathic remedies. So we are very, very flexible with that, and we see what works best with you. If you're very imbalanced, and I know that today I had a patient which was really, she was so agitated. She had a premenstrual syndrome, and she came because she literally hit her husband with a pack of frozen spinach just because he was disturbing her when she was reading a book. So she said, it cannot go on like that. I said, honestly, I said, I also think that is a little bit too much. So we said, okay, let's try to do something. And she had that now for quite some time. So we were discussing the options, and it was not enough with the herbal medication. So I said, so we have the choices. We could go on a synthetic hormonal replacement therapy like the birth control pill, because in the perimenopause, you have the ups and downs of your hormones, and you never know, I'm in the up this time or tomorrow I'm in the down phase. So that is with the progesterone, it's really not very predictable. And she wanted to do, she also doesn't want to become pregnant in the moment, so we put her on the pill today. But if she wouldn't, if there wouldn't be no need to go on the birth control pill, we could also put her on a bioidentical hormone like progesterone. What is the difference? Synthetic hormones are artificial hormones which are not known to the body. Therefore, a lot of side effects could happen, like depression, mood swings, anything, especially also the symptoms which you just want to prevent. Or you go on bioidentical hormones, which means if your body misses out progesterone, you give progesterone and not dienogest, which you also recognize by name is completely different. So that's actually how we treat these patients.
Okay. Poor guy who got hit by the spinach.
He survived.
But I can relate to it because when the hormones are playing on you, you also don't know what the reaction is going to be. So I can understand. If my viewers, you all also agree with some experiences, just put your thumbs up. We are all in it together. One more thing that happens during this phase is that, you lose your little confidence or whatever because of this weight gain and, in this peri. So what can you say more about this perimenopause? What to do?
So that I was fearing that question because weight gain is very, very difficult. If there
Yes.
was a wonder pill and the wonder treatment, I would be slender. I would be size 0, believe me. So the weight gain in perimenopause is actually, of course, it is also due to the lack of progesterone. Remember, I said the first hormone is missing, and progesterone and estrogen are still there. So an estrogen lets us grow. So we have the estrogen dominance, what we call. So that's the reason why we gain weight 1 to 5 kilo over the years. But on the other hand, admit it, if you're 35, 40 years, you are a mom, you are a wife, you work, you do have so much stress, and the stress also rises the cortisol from the adrenal glands, and that also, so to use up the stress, the body produces lots and lots of cortisol and needs a lot of sugar. So it makes us crave for sugar, but also rises the sugar levels in the body. And that's the reason why anything you eat is really, you have it on the buttocks, you have it around the belly, so you can really feel it going on. And the other thing, if you're so busy, you also have a lack of exercise. Most people at that time have with the children a little, no time to exercise as much as they would do or could do. So it's actually always to treat it. We actually treat it with progesterone. We treat it with a natural and a healthy diet, and we treat it, unfortunately, with exercise. I have to admit, bad. But ladies, if you want to lose weight, that's the only 3 things you have to do. So after perimenopause, we come into the second stage, which is menopause. And isn't that picture very, very, very lovely? It's my assistant. She already was started singing recently. Itchy bitchy. I don't sing, I promise. Sweaty, sleepy, bloated, forgetful, psycho. It is really fun. And I promise you, we have these symptoms, at least one of that. Everybody gets that. So just more or less. And again, very important, even if you see all the symptoms, it is no disease. It is your normal aging process, but it could have a big, big impact in your life. And you can really be very bitchy at that time. It happens around the age of 45 to 54. It can be also much earlier, I have my youngest patient in the moment is 24, so she actually run out of eggs. So she did come into menopause, which is, of course, it's a natural process for her. It's difficult because she hasn't had any children by now, so that is then really a medical problem. But it can happen once you run out of eggs, and that is caused by genetics, like in that patient. It can be caused by age. It could be like removal of the ovaries. It could be induced by chemotherapy or other medication. It could be by radiation. But, and that's very important, also smoking and malnutrition. So if you don't eat well, if you're malnutrition, then it could be that you have an earlier decline of the eggs because you just destroyed it. And it means now, I said perimenopause, no progesterone. Now you also have no estrogen. Your doctor, if you're not sure what you have, which phase you are, and what you should do, could test that via a blood test or saliva test. So everything is available. You just have to go and see your doctor. But treat it or not, it's absolutely what to do. It's really up to the symptoms. So you start now to have a choice. You could do nothing because you feel bad. Not everybody has a lot of symptoms or no symptoms, or you can go with that. You can just, if you have symptoms, you can treat it to relieve the menopausal symptoms. What could you do? Again, it's always, lifestyle, aerobic exercise, of course, no smoking, less alcohol, acupuncture. We also give vitamin D and E. So it's a whole bundle of things which you could do. We very often give soya or phytoestrogens like rhubarb root or yams or donkai. So we really, whatever is available in which country, there are many possibilities. But you could also do homeopathic mixture remedies like pascofamine or sepia. But now the other thing, now it gets interesting. As we get older, I told you menopause is just half time. I plan for myself to be at least 100. So I plan to do that in a healthy way. And what is brand new, or not brand new, but it's discovered in the last couple of years, is that after, when we go into menopause, we have 5 years to think about whether we also want to prevent diseases. So if the estrogen and the progesterone and the testosterone goes down, we have a higher risk of arteriosclerosis, which can cause stroke or heart attacks. We have a higher risk of cerebral sclerosis, so difficult words, which is a cognitive decline, loss of concentration, Parkinson, Alzheimer's, dementia. We have a high risk of osteoporosis, and especially also bowel and ovarian cancer. And to prevent that, we would have 5 years after the cessation of your bleeding to think about, which is the so-called windows of opportunity, to think about whether we want to take hormones to prevent these diseases or not. We have hormones like the synthetic hormones, but with these synthetic hormones, we have, after 10 years, a increased risk of breast cancer, so we don't prefer that. We prefer this for short-time treatment, yes, but not for long-term treatment, or we go into the so-called bioidentical hormones. And if you balance them, if you're checked, you don't have that cancer risk. So if you need, you don't definitely have to take something. If you have a fantastic genetic code, or if you have a very, very good family history, but if in your family history, if you have something like Alzheimer's, you at least should consider taking hormones. So after that, I already mentioned that we go in the third stage of the aging process. We go into postmenopause. So even with the hormones, when the hormones go down, we of course we age, but we want to stay smart. We want to be funny. We want to stay confident. And when I'm old, I want to exactly look like her. So I already start with the big glasses, you can see that. And now also the testosterone goes out. It's the third hormone which is produced in the ovaries. So we get wrinkles, a little bit. We get the muscles get a little bit flabby, but in the end, it's for us a much nicer face, because we reach homeostasis, which is actually, again, a balancing of the hormones. It's not, the hormones don't go up and down, and the body now can get used, because the 3 hormones are missing, and that stays the same, and it's not going today a little bit of estrogen, tomorrow no. So we are getting balanced again. So in the end, what we do now, we should take care of ourselves. So please do, because at that phase, one organ is completely missing out, we have the other 3 left. Please do regular checkups, to check your blood pressure, check your cholesterol because of the atherosclerosis and anything, check your blood sugar because of the weight, do the skin check, do the breast cancer exam, do the mammogram, because without the hormones also are one of the barriers against cancer. So we need them, and now we miss them out. So we have a little bit increased risk. Of course, do the vaccinations now with COVID and anything. And if you want to do, check your hormones once you decide to take hormones. If you take hormones, get them checked on a regular basis. Balance your hormones to support your body system to counteract the side effects from the hormonal withdrawal, the aging disease. So to recap it all, you have no therapy. You have a symptomatic therapy with exercise, lifestyle, meditation, positive thinking, also do your brain checks, do brain jogging, what we say when you do the cross puzzle thingy, do a healthy diet, use oils, do acupuncture, really do something for yourself. And then it's the preventive and symptomatic therapy, it's the synthetic hormones on a long distance, do prevention via the bioidentical hormones. When should you actually see your doctor? I always tell Nina, go and see if it's a 6 weeks rule. If you have symptoms like depression, lack of urine, the incontinence, bleeding disorders, lumps, but also coughing, diarrhea, longer for 6 weeks, then at least you should go and get yourself checked. So now I'm ready and I'm waiting for your questions. But thank you so much for listening. I hope it wasn't too fast.
No, it was very nice, very informative. So I didn't want to, intervene, and it was really very nice. We do have a few questions and a little bit of time, so we can take these questions in between. Disha is asking, is there any hormone which affects our hair growth?
Yeah, definitely. So it depends. Usually, as you said, we have the decline of first the decline of the progesterone, and then we have the hair growth actually on the wrong side. So we have hair growth here on the chin, suddenly get white or black hair, and of course, if you give more progesterone, that's fine. But the other thing is we have, once we go into menopause, we have hair loss here, and we have later on the hair loss of the pubic hair, and that's due to the testosterone. And after the menopause, and if we have the hair loss here on the head, it's very often to the estrogen. So it's actually, if you go and see your doctor, he will look where the problem is. Is it too much hair? Is it too less hair? And then we can counteract it. We will measure the hormones, and then we can, especially for the hairs, we usually give a special made remedy with a little bit estrogen, and we just balance the hormones.
Okay. We have one more question. Thank you. Could you explain the side effects of hormonal supplements?
That depends. So if you have like the synthetic hormones, like I said, if you have a lack of progesterone and you get dienogest, both helps if you have, for example, the hormonal perimenopausal symptoms, but a synthetic hormone is much stronger than a bioidentical hormone, and we don't know the side effects. There was a very, very big study from US and for all other countries which said if we take hormonal replacement, synthetic hormonal replacement therapy for longer than 10 years, we have an increased risk of breast cancer. And actually, who wants to have that? So we, in the moment, we are very much on that, because in the same study they said if you take natural hormones, you don't have the risk of the breast cancer. But of course, if you take bioidentical hormones and if you overdose them, I also think you have the same risk. So if you take hormones, if you decide to take synthetic hormones out of certain reasons, because they have a very, very irregular bleeding, then you need the stronger ones, then take it for a certain time, but not longer than 10 years. Very, very preferable shorter. We usually give it for 1 or 2 years. Or you say, okay, I decided to go on a longer treatment because I want to have the prevention as well, then go on bioidentical hormones, but those should be, if they're balanced, at least be checked once a year.
Okay, thank you, Katrin. Disha says, thank you for answering the previous question about the hair. And this was Mangla's question. The next question is Teresa's. She's asking what kind of treatments are there for bladder weakness?
The bladder weakness is also a very, very common thing, because once the estrogen goes down, the tissue is getting weaker, and so the bladder and the muscles get weaker, so the muscles don't get so tight, and so you have a leakage of urine. So we usually we always start with estrogen, either as a suppository or as a cream. But for example, if the leakage is after delivery, when you're much younger and you don't have the problem with the estrogen, then at that early stage, we usually give high dose progesterone, because that is caused by different mechanisms throughout the delivery. And in the end, and then we go with that for in a very special scheme. You have to how often you have to take it. Then we reconsider after 8 to 12 weeks. And then I might give maybe some testosterone cream as well. So it's a really complex thing, but we also measure the bladder. We also do pelvic floor exercises. You cannot do without that. And if it's a really damage of caused by deliveries, caused by heavy lifting, because you take care of your mom or anything, and then of course we also have to consider, is it really a mechanical or is it a hormonal problem? And then we have to address it appropriate to the cause.
Okay, thank you. We have one more question, maybe the last one now. Mangla says, thank you for answering her question on hormonal supplements. How to get rid of period pain for young girls? Is there any?
That is quite good. So it's we have, of course, you could take something like Buscopan, ibuprofen. So it's the painkillers which you can buy nowadays. But very often at that phase, we also take either very low dose, like in a homeopathic, like progesterone D4 in a homeopathic way, or we also use magnesium. It's a multifactorial thing. You also have to, of course, to see, is it hormonal done because everything is not working well? Is it a disease like endometriosis, which is also caused by it's the origin comes at that time? Then we might be better off with hormones. So we really have to see the girl. We have to talk with her. Is it just that it's really plainly once you have a menstrual bleeding, or does it start 1 week before, like the premenstrual syndrome a little bit? Then I would prefer progesterone. If it's just throughout the bleeding, I might consider the birth control pill. But we always go with high dose of magnesium. We take warm. We take, of course, sometimes a painkiller. So we really have to see the girl and ask the mom and see them together, see how it runs in the family, and then address the problem very, very individually.
Okay, Katrin, I have one more question is coming up about this very latest thing called the menstrual cup. Any thoughts on that?
Very, very common. It is very good for the environment because we don't have so much waste. And it's then actually, I think it's a little bit too much for when you're 14, you won't use a menstruation cup. So it is something for once you turn 20, 21, something like that. It has, in the moment, it's available in 3 sizes. You have to, and the sizes change a little bit from which company you buy it from. Usually, if you have no kids, you start with a smaller size. If you have kids, then you go for a bigger size. But it is no problem with that. You just have to change it regularly. You have to make sure it's clean, but then it works absolutely perfectly.
Okay, brilliant. Thank you. And how long does, when the girls start their periods, how long? Like some I have seen 3 days and some have even for 10 days. So what is it worrisome if it goes on for 10 days?
It's
especially
not
when they start.
worrisome. It's the same. It's puberty is actually vice versa to perimenopause. So
Mhm.
a long bleeding occurs because the ovulation does not take place. It's not like the proper rhythm in the reproductive phase. And in puberty, it's because the ovary starts really to work to its fullest. And in the perimenopause, you have the decline. But actually, in both phases, you have a problem with the ovulation. And so that means you have no progesterone. The estrogen keeps the hormones rising. And then because then usually at the mid of the cycle you have the ovulation, and then that stops the estrogen from rising. But because you have no ovulation, you have a lot of estrogen, which means you have a lot of lining in your which we call endometrium in the uterus. And that means you very often bleed heavily, and you bleed for a longer period of time. So actually there we would address it with small doses of yams or small doses with Agnus castus, or if that's not working, also probably with progesterone in a homeopathic remedy or with a real progesterone. So I think that works really very well.
Thank you so much. Thank you, Katrin. And that's all the questions that we had from the viewers so far. I'm sure there'll be more coming. And a lot of people have written that it's great info that you have shared, and it's been a good show. So thank you so much for your time. There were so many questions. I'm sure they're going to help so many of my viewers. And we will have you back again on the show, maybe on some specific topic, and we can talk more about it, because I think topics like 30 minutes is not really enough. So we will keep talking the girl talk very soon.
We
You,
do. Have
yeah,
a lot of greetings to Sweden.
thank you so much. Tack så
Okay,
mycket. So thank
bye.
you and have a good evening. We'll see
We
you again
do
very soon.
relax.
Yeah, thank you,
Relax.
Kat.
Because relaxation is the most important thing.
Yeah, yeah. We need to do some relaxation and anger management also with all these hormones.
Don't hit your husband with a spinach.
Yeah. Okay. Have a good
Spiritual way.
time. Yeah. All
Okay.
right, Jasmine. I'll see you. Bye. See
Bye.
you. Thank you so much for today. Thank you.
Thank you so much.
So that was Katrin joining us from Germany. How informative. I hope you got a lot of information that you were looking for from this show today. Next week, we are going to have with us Rajat Chawla. He is, I'll just He is the founder and CEO of Koyopo, an employee and customer experience transformation company. Rajat is Asia's first certified customer experience professional. Rajat is also an author of a book called Customer Experience Design Book. So he's going to be with us talking a lot about the IT industry and on customer experience. So let's meet him and get to know more about what he's going to say. Till then, you keep rocking 2021. This is January. We are just starting off with the new year. So have a good time. See you next week. Have a great week. Bye.